All right, Pamela. So it sounds like from what we were talking about that you were having a little trouble with the diaphragmatic breathing exercise last time, that it was a little hard to follow. So what I want to do this time is introduce a different breathing exercise. It's a little bit of the same, but it's a little more organized. And so, that way it might be a little easier to follow, a little easier to practice on your own, and might even make like a little more sense for um, what the process is. So, this exercise is called mindful breath counting. And so basically it's going to be using that same kind of deep diaphragmatic breathing, but this time we're going to have a little bit more of a structure into how we do it. So basically what the process is that you're going to be counting sets of inhales and exhales. And you're going to do sets of 4, and then you're going to start over. So basically the idea is we do that deep diaphragmatic breathing, and then on the exhale we say 1. And then after that one, 2. Same thing. 3. And then we do one more. 4. Right, just like that. And so then when we come to the end of the set of 4, we start right back over at 1. And so that way you get yourself these nice little sets of deep breaths. Kind of helps you get a consistent pattern going as well. So we'll do the sets of 4 and you'll start over again, and then we'll do this for about 5 minutes. Usually we're going to do it for about 10 minutes, but since it's the first time and you're still practicing this, I'm going to do it only for 5 minutes, and then we'll kind of move on to a little bit of a longer time for homework. So, when you're doing this, there's going to be thoughts that like enter your consciousness as you have your mind try to go blank. And what I want you to do is similar to our other kind of mindfulness exercises is just let those thoughts come and, have them come without judgment or expectation, and then return to counting those breaths. So if they do kind of come up a lot and you feel like you're being consistent with the breath counting, what you can even do is kind of label those thoughts when they come up. So you can kind of say to yourself, just kind of like thought, the feeling, like what it is, and, acknowledge it, and then get right back to that counting, because we want to keep our focus and attention on those deep, consistent breaths. So do you have any questions before we get started?
No.
Okay. So before we get started, just like our other exercises, I want to get a sense of those subjective units of distress, those subs we talk about every time. So if we had to do that scale of 1 to 100, about where are we right now?
I'd say about 60.
60? Okay. So what we're going to do is we're going to keep that 60 in mind, and then I'll come back to it after, just like we've been doing. And we'll see where you're feeling after the exercise. Okay? So what I'm going to do now is I'm going to set a timer for about 5 minutes. And when I say go, I want you to start doing those counts of 4 breaths. Try to keep it as consistent as possible in a good rhythm. And then when the timer goes off, we'll stop the exercise. Okay? Are you ready? Okay. Go ahead.
1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Okay, let's bring our attention there. So how'd that feel?
Pretty good. I feel better after that.
Okay. Why don't we look at that subjective units of distress again? We were at a 60 before. Based on 100, where would you say you're at right now?
Probably 55.
Okay, so we did a little bit to knock off some of that. A little bit still good. And how did you like that compared to the diaphragmatic breathing?
I liked it better. I was able to keep a mind with the counting. Counting helped to keep focus.
Okay. So maybe having a little bit of something to follow along with is a little better.